graduated from veterinary school in 2008 as a proud Buckeye from the Ohio State University. And then I went on to pursue my specialty training with an internship, a general rotating internship, followed by an internal medicine critical care specialty internship. And I completed my 3-year residency in small animal internal medicine at Gulf Coast in Houston, Texas. It was a phenomenal program. I think on it fondly, at least weekly, if not almost daily. Something comes up to remind me of that experience. And I couldn't think of a better way to spend those years to make myself really skilled in internal medicine. And then after I finished my training, it became board certified. I went the traditional path and going into clinical practice. And I enjoyed working in a variety of different clinical settings. I had the opportunity to join a very large multi-specialty 24-hour hospital with, all of the bells and whistles, which was a great experience. And then also had the opportunity to participate in a startup with bringing on an internal medicine department to a recently acquired emergency hospital. So that was a really unique and exciting experience where I was involved kind of from day one. And that's where I really started to enjoy and embrace how impactful relationships were. I think most of us get into the profession because we love animals. We want to help animals. And I think we place a little less emphasis on the people aspect. But when I really started to recognize how crucial those relationships allowed me to be successful in building that, which allowed me to provide more care, help more patients in need, I really started to redirect my focus. And that not only came from just client experience and my relationship with the clients, of course, but it was also the referral partner community and realizing how important supporting my doctors in the community and ensuring that I understood their expectations, their priorities, and how we could work so collaboratively. It just was a really tremendous and eye-opening opportunity for me. And that's really where I started to shift kind of my thought about my career. I had also had the opportunity in that position to start being a little bit more behind the scenes and diving into some discussions and decisions around equipment or the department as a whole and appointment flow and, how we worked with other specialty departments or the emergency service. And so that's actually when I made the choice to pursue my executive MBA. As I was completing my MBA program and nearing graduation, I started to kind of realize I wanted to be more deeply involved on the business administrative side of things and was ready to pursue a role that supported that and kind of press pause on my clinical skills. Mm. I think our industry has such a talented group of individuals who are so compassionate and empathetic. And I think a lot of people who are caretakers and always put others before themselves often forget to take care of themselves. And so I think that's also one of the main reasons I stepped away from clinical practice because I felt like potentially I could have a greater impact in creating, opportunity for other clinicians to really thrive and be happy in their roles without having to feel burnout or, the chronic stress or the chronic fatigue that the position often presents. My focus has again shifted away necessarily from being a caretaker for animals at this point and trying to be involved in an organization where I can be a caretaker for those individuals who are providing the care.